We're not here tonight to give any glory to stigma, but we're here to put stigma where? Under our feet. That's right. So I think that one of the things that I learned from a book that I have read, that if we never confront a thing, we can never hope to overcome it. So it's only by identifying it, calling it out, confronting it head on, do we become overcomers and we become conquerors. And tonight we're certainly going to have an opportunity to address this topic of stigma. You know, I listened to and I read some of the program about how the organization got founded, and that individuals who found out that they were positive over 2 decades ago still had to overcome or deal with stigma. Where's Violet? Is somebody trying to get the equipment to work? What I'm going to do is, I can see the slides and I'm just going to talk through them.
There you go.
All right, so tonight, and when the slides finally come up, you know, I want to at least give credit to the educational departments of the pharmaceutical industries for at least putting together these educational decks to give us a forum to talk about. When an individual first finds out that they have HIV, they experience a range of emotions. And for some individuals, they remember the date and the time that they got their diagnosis. And some of those feelings predominantly are negative ones. And some of them, of course, begin to feel shame, or they feel angry. Some of them feel alone. Some of them feel afraid. And the good thing about it is that we don't dwell there. All right? We don't stay in that state of negative emotions, but we begin to overcome. And one of the things that I've learned along this journey, I learned from one of my patients, and I heard him speaking at a conference. And he said that when I received my diagnosis of HIV, I began to live a reckless life. Drugs, alcohol, out on the street, sleeping in my car, sleeping in the park, because he just believed that his life was over. And one day he came to the realization that I am not going to die from AIDS, but I'm going to live my life and live it well with HIV. So I was in the audience that day and just inspired by what he said. So I went up to him afterwards. He became my patient later. And I said, I'm going to use your words as a travel. What Mario did was he went to a support group, all right? And I understand that one of the founding members of this organization founded a support group in the early 90s because he recognized that individuals living with HIV needed some type of support structure to be able to successfully overcome the diagnosis. And during that time, there weren't that many effective treatments. He was not ready to yet tell his family, but I think that what I really enjoyed was that he found a friend. He found someone in that support group who could be a buddy to him, who could be a source of strength for him, who went with him to his next appointment and began to help him ask the right questions so that he could better take care of himself. And I think either you've done that yourself, you've known somebody who has done it. Some people have a buddy-buddy system, and we have staff members who are living with HIV who do the same thing for people who are coming into the clinic for the first time in care. What Yvette did was she went online and found how to be able to garner support. Sometimes all we need is just a skill, a way to get the support that we need So she learned how to tell one of her closest friends about her diagnosis, and there she was able to find someone to help her keep her children when she went to her doctor's appointment. So her point was that anybody living with HIV can find support when they need it. Anybody living with HIV can find support when they need it. Yeah. Yeah. I think that I'm not going to spend a lot of time on this slide, but what people need to understand is that everybody, because of their humanity, just have rights. And you need to know in your own state. All right, I'm gonna work it. You need to know in your own state, what are your rights? What are your rights to privacy? What are your rights to employment? What does your employer or or your healthcare worker need to know? And I would encourage that when you go to a healthcare provider that you have formed a trusting relationship with, to disclose. It helps us. It helps to be able to take care of the whole person, But yet there is stigma still in the medical community. I know that. I know that for a fact. But fortunately, you can find a healthcare worker who can work with you. Yeah. We've already talked about this. I think that one of the questions that we have to help people navigate through is, when you are going to disclose, you need to ask some questions. Who am I going to tell? Why am I going to tell them? What is the purpose of them knowing? And what we do with our adolescents. This is what we do, and this is done across the country. When you have an individual who was born with HIV, and they come to the age of being teenagers and being involved, all right, in their individual club sports, we encourage them to make a list of individuals who need to know, be a source of support for them. And they do this with the assistance of their parents or their guardian. All right? And one of the things I learned from one of my papers is that a burden shared is a burden. A burden shared is a burden lifted. A burden shared is a burden lifted. And what we have learned, all right, is that we don't have to carry the cross alone. That's right. All right? Because everybody's life has what? Meaning and purpose. All right? And when you find your meaning and your purpose, and you know that your life has value, you can do something about it. That's right. So I try to encourage people who cannot bring themselves to stay in care, to take their medicine, that this is what we have to do. Now let me tell you something else about myself. I knew I was a preacher before I was a doctor. So I've learned that God loves everybody. All right? So I've learned to value everybody's life. Even those I struggle to like, that I didn't make them, so I can't determine their purpose. And I just want to say thank you. Thank you for the opportunity to come down. Thank you, Violet, for the invitation. Thank you for being such an attentive audience. And we've already talked about why we would want to disclose. And I think that I take this approach. I've been a physician for I graduated in 85. Somebody do the math. All right, 26. Okay. Thank you. For 26 years. For 26 years, I've been in healthcare. And when I first encountered individuals who got a diagnosis of HIV, there were no medicines to treat HIV. I was at Grady Hospital, and we wore 3 sets of gloves, disposable gowns, masks, and disposable stethoscopes, all right? Because we didn't understand. We didn't understand. And as a young resident, in my first year of training, one of my classmates came into the emergency room who had HIV and AIDS, and he died within the next couple of days of cryptococcal meningitis. And I had my own moment during that time. And I had my own attitude adjustment, all right? I was doing a procedure on him in the emergency room, a lumbar puncture. And when I withdrew the stylus from the needle, some of his bodily fluids got on my clothes. And I became angry. And I stomped out of the emergency room. I was 3 o'clock in the morning. I was angry. I took my clothes off at the doorstep, put them in a trash bag, went inside and showered and bathed. And I said, how dare he come into this emergency room and expose me? And I was rebuked. I was rebuked by an inner voice. All right, I was rebuked by an inner voice. All right, that said, you shall touch this thing, all right, and not be harmed. And I began to change my attitude about individuals living with HIV and began to be able to embrace them and to hear their story and to take this journey with them. Again, when you do what? When you walk with purpose, you collide with what? Destiny. You collide with your own destiny.